Welcome to Health Time TV. Today we have with us Dr. Pooja Malik. Dr. Malik is a board-certified family medical graduate, currently pursuing fellowship in anti-aging and regenerative medicine. Dr. Malik completed her postdoctoral fellowship at Johns Hopkins University, specializing in international health. Welcome, Dr. Malik.
Thank you.
And thank you for joining us today on Health Time TV.
Thank you for having me.
Dr. Malik, you're currently practicing aesthetic medicine in Malik and in Vineland at your medical spa. Would you like to tell us a little bit about the medical spa?
Yes. We have a full-service medical spa in Malik and we opened a second location in Vineland. We offer a lot of procedures, including injectables. We offer Botox, Juvederm. We offer a couple of different fillers like Radiesse, Restylane. We do have a full range of laser services available as well. We do laser hair removal. We do laser resurfacing, which is for wrinkle reduction and for pigmentation issues for the patient. We do treat a lot of acne patients as well. We do some pharmacotherapy, meaning drug therapy for them, and we have some light-based treatments for our acne patients. Also, we do laser liposuction in our medical spa. So, including my staff at the spa, we have a few estheticians that do medical grade facials and chemical peels. We also have massage therapists. In a nutshell, we do offer a full service medical spa.
Yes, definitely. It sounds like a full range of services offered. And I heard you mention something about laser liposuction, which I'm sure maybe some of our viewers aren't too familiar with. We're familiar with the normal liposuction, but can you tell us the difference between this laser liposuction and the standard that we're so used to hearing about?
Liposuction can be done a few different ways. Liposuction has evolved a lot over the course of a few years. Laser is just one of the tools. There is ultrasound-assisted liposuction, which is called Vaser, and by laser, the recovery for the liposuction is really faster. So it's pretty much a painless procedure. You melt the fat with the laser. You use the local anesthesia, which is the tumescent anesthesia. You use local lidocaine. Patient is totally awake for the procedure. It's totally safe without any side effects, and the recovery is very fast, very less bruising with the laser, and the skin can tighten very nicely.
Interesting. It's interesting that you have a broad range of specializations. I wanted to ask you a little bit about the weight management service that you provide at the spa. Would you care to talk to the viewers a little bit about that?
Sure. Our weight management approach is very different from other weight loss clinics. We offer a metabolic approach. We look at various imbalances in the body that make us gain weight. We do look at our hormones, which is one of the major culprit in a patient gaining the weight, like around the holidays, which is the stressful time of the year. A lot of people will have higher stress levels, and you know that the adrenal, which makes the cortisol hormone, is an issue. So we do look at that. We also have a nutritionist in the practice. We do a detailed blood work.
So it's very interesting that we can actually trace back our weight gain to hormones and things of that nature. Is it possible that we can pinpoint where and how we're gaining weight and actually track it that way?
Actually, to a certain extent, you can. You can look at the various hormones, like I mentioned. Cortisol is one of them, insulin, thyroid, which are the major culprits. You can also look at a lot of vitamin testing, which tests a very detailed panel of the micronutrients, minerals, and the vitamins. Also, we live in a very toxic environment, and there are specialized tests these days that can find those toxins.
So along those lines, you would come into finding out about detoxification. Is that something that you would offer at the spa as well?
Some of them depend on what the test results show. So we do a blood testing, we do some saliva testing, which are the special kind of tests to look at these things. And depending on where the patient is testing positive, we cater to the detox program to that. Also, there are certain other detox which are done by the nutritionist in the practice after a massive weight loss. Say if somebody loses about 15-20 pounds, you know that your body needs to detox to process all that weight loss.
So in developing a proper treatment plan for weight management for a patient, you're going to start with taking the tests, and then break it down for us from that. What is the next step after taking some hormonal tests?
Weight loss is actually customized for each and every patient. We do a very detailed testing and a very detailed exam. Based on the testing, whatever the hormonal deficiencies, all the nutrient deficiencies are, we do replete that. And after that, we often see that the metabolic rate of the patient comes up and the patient will start losing weight by themselves. Also, we have few other tools in the practice, and one of them is the HCG diet therapy. HCG diet, it is a very good jump start to the body. You can lose between 15 to 25 pounds a month, and that is a good way for a patient to start and then follow with the nutritionist onto a maintenance program.
Dr. Malik, you mentioned HCG therapy or the HCG diet. What does that stand for, and what is that diet exactly?
HCG is a pregnancy hormone. It has been out for the last 40 years. It was discovered by Dr. Simmons, and HCG, like I said, it is a pregnancy hormone, and it was discovered that in very low doses, it induces fat breakdown.
Really?
Yes. HCG involves a very low calorie diet. It has to be done under the supervision of a doctor. You need special kind of vitamins, and you need to do a detailed workup of the patient before they can start, and not everybody is a candidate for the HCG diet therapy.
Stay with us here on Health Time TV. We'll be right back. Welcome back to Health Time TV. We're here with Dr. Malik today. As a patient, when you come into the medical spa, you'll be able to get an evaluation of which plan would best suit you. And how would that work if I were to walk into the medical spa seeking treatment? How would you best design a weight management plan for someone like me?
Actually, we have a customized program for everybody. People who cannot do HCG diet therapy, we definitely look at the hormones, we definitely look at the nutrition part of the program, and they are customized programs which are supervised by the nutritionist and are actually run by the nutritionist, customizing it to their needs. And there are some natural herbs and botanicals that we use as carb blockers and thermogenics, which increase the burning of calories in your body, which those patients can use.
Sounds interesting. I noticed that there's a lot of women through the years that have been involved with fad diets and are actually physically incapable to keep dieting. So if they were to come into the medical spa and have had a history of doing some damage to the body, are there programs that they would be able to find as well that wouldn't offend their body as much as maybe some of the past diets that they were involved in?
Yes, definitely. We do have something called an insulin balance program, where insulin, which is one of the major culprits in weight gain with the cortisol, you balance that with a plant-based diet. And there are a lot of other options you can use with them. Like I'd mentioned, again, with herbs and botanicals, you can really customize a program for them.
That's very interesting. Dr. Malik, how is the HCG diet different from other diets?
First of all, HCG is a physician-supervised diet. HCG is a very low-calorie diet, so it should be done under the supervision of a medical doctor. Also, HCG, there is there are some postulated hypotheses how it works. It resets the hypothalamus, which is the center in the brain that controls the satiety, and also it increases the testosterone level in the body. So that being said, we know that testosterone is more muscle, so the metabolic rate of the body gets higher. So if you're burning calories, say at a rate of 1,000 and HCG, you're going to burn at a rate of 3,000 to 4,000, losing about half to a pound per day.
Okay, so that's kind of describing the diet to us. How would I be on the HCG diet? What would I have to do to be on the diet?
HCG comes in two different forms, actually three different forms. HCG comes as injectable therapy. You have to do daily injections with a very small needle like an insulin syringe. HCG also comes in sublingual drops, also intranasal sprays, but the most effective way to do is the injectable one. It is a 40-day program. The patient has to be on it for 40 days, and then there's a maintenance part of it. That is why HCG therapy should be done under supervision of a medical doctor. And in our practice, we have a nutritionist who weekly supervises these patients because they also need the injectable B12. They also need B12 injections. They need some potassium, and they need some special kind of vitamins while on this diet.
So in addition to the injections that we would get on the diet, are there restrictions with food, and is there a lot of exercise required?
There are only certain kind of food groups that you're allowed to eat while being on this diet. There are no carbs that are allowed. There is a very high protein, so there are 2 meals per day. But if somebody is interested, they can contact the practice and they can get detailed information on that. Also, there is no kind of cardio or no kind of aggressive, heavy exercising allowed on the diet therapy. There are some light walkings that the patient can do, but no aggressive, vigorous exercises.
So for a lot of people that struggle with the exercise portion of diets, this seems to be a more attractive diet and doable as far as being able to lose the weight successfully.
This is a very good way of losing weight for short term. Yes, this is not for long-term therapy. Patients are not going to be on a very low calorie diet for long term. So for a 40-day program, yes, it is a good way for patients who need a jump start to their body, who cannot exercise a lot and still want to lose weight. This is a good way to start.
Okay, so say if I had a reunion to go to in a couple of weeks and I needed to lose weight quickly, this would be the type of diet, the HCG diet. I would be able to find those benefits quickly.
Yes, if after initial evaluation and if you are a good candidate, yes, this would be the answer for that initial jump start to the body and losing all that weight.
And especially after the holidays, a lot of people are trying to get fit and trim for the new year, so this HCG diet is something to look into.
Definitely after the holidays.
So in going back to talking about the treatment for the skin, do you have any tips or advice that you would offer to our viewers for helping to keep the skin looking young?
Well, there are a few things that we all should be doing while at home. There are some skincare products or some skincare regimen which everybody should be on, and they can talk to their esthetician or their skincare consultant or their dermatologist or doctor. There are a few important things like using or cleansing the skin daily, twice a day with a very good wash. Also, toning your skin after that. And if you are in your early 20s to 30s, then using a good kind of moisturizer with a good sunscreen with an SPF of 20 to 30, even in winters. Then in somebody who is in their 40s, you're looking at adding anti-aging serum like a skin vitamin, because the oral vitamins really do not touch the skin. So you really need to use a topical vitamin from top, like a vitamin C or a vitamin E, for the skin to get the benefit of sun protection and also the rejuvenation and anti-aging benefits of that. If somebody is in their 50s, then they really need to look at, because that is the time in the late 40s to 50s when you start to see a lot of volume loss, thinking about some of the laser procedures for wrinkle reduction and also fillers and things like that. And also for younger patients, if there are any issues with wrinkles, that can be addressed by some injectable therapies like Botox and things of that nature.
Which these services are all provided at the medical spa?
Yes, they are.
So the Botox treatment, is that something that you can do just one time and receive lasting results, or is that something you have to do continually?
Well, the Botox only lasts between 3 and 4 months, so you really need to do a repeated therapy and maintaining on it every 3 to 4 months. Fillers, on the other hand, are longer lasting and they do get results anywhere from 9 to 12 months or 6 months, depending on the area you're throwing the product in.
So how would you decide who would receive Botox and who would receive fillers?
It depends on the patient what the concerns are. So, say if in the forehead the patient has a lot of forehead lines and the 11s in the center, they are candidates for Botox. Crow's feet, a lot of patients have smile lines, those are treated with Botox and similar products like Dysport now. Also, for patients who have concerns about their nasolabial folds, the lines around the mouth and around the nose, that is a filler. If somebody wants to augment their lips and make them fuller, that is a filler. And also, people do want fillers in their cheeks for cheek augmentation and things like that. But it really is customized to what a patient wants. And most of the times, you actually do both of them on a patient.
Stay with us here on Health Time TV. We'll be right back. Welcome back to Health Time TV. We're here with Dr. Malik today. Dr. Malik, what are the most common areas that are treated for laser liposuction?
Most commonly that we get patients for are the abdomen, the upper and lower abdomen, the love handles, the bra fat area. Also with laser now you can treat smaller areas which was not possible earlier on, like inner thighs, arms, neck and chin, and the jowl area, that you can really treat nicely and get nice aesthetic result with a good amount of skin tightening with the laser liposuction.
Can you find that women that are interested in receiving perhaps a tummy tuck or a cosmetic surgery of that nature, that they could choose laser lipo instead?
Well, you have to really evaluate the patient. Some patients who have a lot of skin laxity are candidates for tummy tuck or abdominoplasty. But patients who do not have a lot of loose skin, they can definitely go for laser liposuction, which is definitely a simpler, safer, and a much faster recovery procedure.
And again, we should mention to our viewers at the medical spa, a patient can come in and receive an evaluation for what best suits them.
Yes, we do offer consultations which are free, so anybody can come in and we customize because we do offer a lot at our facility, and whatever their needs are, it is suited to and kind of catered to whatever their concerns are.
So if you're a patient that isn't interested in receiving the injectables that we mentioned, like Botox and fillers, what are some of the other options that we may do for the skin resurfacing?
There are some laser therapies like fractionated laser therapies on the market that you can do for wrinkle reduction. They do come with a longer downtime, so depending on what a patient can offer us for recovery, the treatment is customized to them. Also, even after doing the laser therapies, I do recommend maintaining with the Botox and the fillers at some point in time. Yes, the lasers are permanent, but the skin goes through a programmed aging, and nobody can stop that or slow that down. But really, you have to maintain it with the injectable therapies.
Now this is the part of our show which is my favorite. We're going to take some questions from our viewers, and we have Tara from Deptford who wants to know how she can refresh her skin right away. She has a promotional modeling event that she has to go to tomorrow, and she wants to know, is there something that she can do to get her skin looking fresh and new?
Actually, we do get that question a lot. So what Tara can do is there are some light chemical peels which rejuvenate the skin and get a very nice glow to the skin. She can do that. She can also do some microderms coupled with that. So that together will give her a very nice rejuvenated, refreshed look.
Here's a really nice question. Mr. Smith wants to know how he can reward his wife with a wonderful day at the spa. So if Mr. Smith wanted to give his wife a little certificate, what would you suggest for him?
Oh, we have so much to offer. Mr. Smith, you can definitely combine a few different treatments. We offer laser hair removal, so if she's interested in that, we offer laser vein therapy, sclerotherapy if she's interested in that, or some medical grade facials or peels. Some good skin, some good physician prescribed skin products.
Okay, we also have Jenna, who is 42. She says she's been struggling with weight management. She's going through menopause right now. She's heard of the HCG diet. She doesn't know if she could benefit from it or not. So we'd like to talk a little bit to Jenna, and maybe you could give her some suggestions with dealing with her weight issues.
So we do get a lot of patients like you, Jenna, and definitely we would start by looking at the hormones. We would start by doing a full workup. We would also do a full nutrient panel, a vitamin panel, looking at different various deficiencies. Also, after depleting and kind of bringing the metabolic rate up by depleting your thyroid and other hormones, yes, if HCG and if HCG is yes, if you are a good candidate for HCG after initial evaluation, yes, then definitely you should go for it and might be the right choice for you.
Oh, we have a question from Malik Hill, actually, and this is from John. John says he's dealing with a facial flaw. He has a double chin, and he wants to know, is there any possible resolution for him?
So John would be an ideal candidate for laser liposuction of the chin and neck area, which we had earlier talked about, again, done by the laser, very minimal downtime. You only need a weekend to recover, and there is a compression garment that needs to be worn, and it is only for 2 days. So John can come in for evaluation, and definitely we can discuss this procedure with him.
And John, the medical spa is right in Mullica Hill, so that works out just fine. Janine's writing into us from Berlin. She says she's heard a lot about the HCG diet. Can she just go anywhere to become more affiliated with this diet, and how would she go about getting more information?
Now, HCG should only be taken from your physician or from the doctor who is there at the weight loss center. There are a lot of over-the-counter health food stores that are selling HCG, and a lot of online marketing companies are offering HCG. Just want to spend and stress upon this point that HCG is a very unstable powder. You cannot keep it on shelf. It does not have much shelf life. So usually the pure form of HCG comes from special kind of pharmacies, which are compounding pharmacies, and that is why it should be gotten through your doctor.
So that's interesting. So how do we get more information about the HCG diet?
Well, viewers can call our practice. We are located in Malika Hill and Vineland. The number is 856-478-4700. And you can also go online. There is ample of information online. There's some forms. There's some very good reading material on hormones and HCG. And the website is www.malikahillskincare.com.
And also keep in mind and remember that the consultations are free.
And also, there is a place on the website where you can email us, and we are very prompt in responding to the email. So if there are any follow-up questions to this, viewers can email us, and I would be more than happy to answer any.
Stay with us here on Health Time TV. We'll be right back. We'd like to thank you, Dr. Malik, for joining us here today on Health Time TV. We had a very enlightening and informative show, and we just want to remind our viewers to follow up and check out Dr. Malik online on her website. If you want to give us that information again.
Sure. You can log on to www.malikahillskincare.com. You can also be reached at 856-478-4700, and we have 2 locations, one in Malika Hill and Vineland.
And be sure to join us here again next week on Health Time TV. And also check us out online and feel free to email us with any questions or comments about today's show or any other of our broadcasts.